Well, how exciting. This is the second week in January, and how many weeks into the COVID-19 response. And I am delighted to say that we have got Wendy Nicholson, who is the Deputy Chief Nurse for Public Health England. And I'll tell you more about Wendy in a moment, but I want to say is how anyone has got some spare time, particularly in Public Health England, to talk to a bunch of nurses at this particular point. I have no idea. So it's with special thanks, Wendy, that you spared your time today. And I can't imagine what your last 9 months has been like. But we'll move on to that in a moment. I'm sure you've got some lessons that you would like to give your experience about. So Wendy Nicholson, what can I say? I first met Wendy when she had finished her scholarship programme. So Wendy's a Florence Nightingale Leadership Scholar. And it was a phone call where we were trying to arrange the next public health nurse, so a school nurse, that Public Health in England were going to sponsor. And she gave me a bit of a telling off, if I'm honest. I don't know whether you remember that, Wendy. I thought, my goodness, but having said that, we sorted it all out. And ever since then, we've been great friends. And the reason I say friends is because once you're a leadership scholar in the Florence Nightingale Foundation, you remain a friend. And every time I see Wendy, Wendy's always said, Greta, how can I help? Now, she probably regrets having said that, because not only is she here today on giving this webinar, but also she has kindly offered her time to be on the advisory group of the Florence Nightingale Foundation Academy. So we're very grateful for that too. So be careful what you volunteer for, is all I can say to everybody else, because we will grab you with open arms if anybody volunteers to help. So it's fabulous that a scholar is here presenting back to our members of the Academy. So Wendy is the Deputy Chief Nurse at Public Health England. She's also the Deputy Head of the WHO Collaborating Centre for Public Health England for Nursing and Midwifery. And within Public Health England, she's the Chief Nurse for Maternity in Early Years Directorate. And she's got a wealth of post-nominals after her name. So I think post-nominals, that's what it actually means. But anyway, so not only is she a registered nurse, she's a registered children's nurse. She's got a master's in child law. She's a BSc in nursing. As I said, she's a Florence Nightingale scholar. So she's part of our alumni network. She's also a Queen's Nurse Fellow. And she has done the most amazing job. So her response for the COVID response has been the responsible officer for providing leadership, expert clinical and public health advice relating to children, young people, families and schools during COVID. And she really is a fantastic ambassador for the foundation. And we're so grateful that I really am grateful that you've spared so much time to not only talk to us this morning, or this afternoon is now, but also how much you've probably thought about what it is that you're going to say. So it's not just about this afternoon, it's about the prep that goes into it. So thank you. And on behalf of the foundation, we are so grateful and we're all looking forward to hearing what you've got to say. So thank you, Wendy.
Thank you. It's lovely to be here.
Thank you so much, Greta, and echo everything that Greta said there, Wendy. So just to let everybody know that's dialed in today, these sessions are audience with sessions. We just invite a few people. So we're really pleased to have a small audience so that you can have an opportunity to have a conversation with Wendy. So we want to hear your questions, your discussions, your debates, getting an insight into Wendy's journey to the position she's at now, and also her experiences of leading in this position, and particularly currently, in light of all of the challenges for children and young people currently. So we want you to get involved. We'll start off the conversation, and the premise of this session is really to give you an insight into the person behind that absolutely amazing CV that Greta just shared with you there. So we can understand, these are the things that I can learn, potentially emulate in my own career, and also that you've had an opportunity to meet Wendy, and you can start that networking with her and her colleagues at Public Health England as well, who are also members of the Academy. So can I start off the conversation, Wendy, and ask you to tell us a little bit about your journey in nursing, and particularly focused on why you see leadership as so central. Why does it matter so much to nurses?
Thank you, and it's an absolute delight to be here this afternoon. To be with other nurses and midwives, and to actually be able to kind of talk about what we all love best, which is nursing. And it's something that is within you from the minute you actually put that uniform on until you decide to leave, and even then you continue with it. And within my family, we've got over 450 years of nursing experience. I've got aunties and cousins and my sister and my partner. We're all actively involved in nursing and midwifery roles, and they're all quite different. So you can imagine dinner parties can be a little bit daunting from those that don't come from the nursing fraternity. But my journey has been quite an interesting one. We were talking earlier that when I really wanted to be a nurse from a very early age. From when I was 4, I decided that's what I was going to do. And despite many teachers at school telling me that I should look for other occupations, I stood by it and actually achieved my ambition to start my nurse training. And when I started my nurse training, I'd got an understanding of nursing because of my auntie being a nurse, and I'd had opportunity to talk to her about it. And I'd also read quite widely, and I'd volunteered at the local hospital on a Saturday and Sunday, visiting the children's wards and elderly care wards, talking to patients and actually giving them cups of tea. So I had an understanding of some of the role, and I knew that this is something that I wanted to do. And my ambition was to actually work on a medical ward when I qualify. That was my ambition. And that never actually happened. When I qualified, my first job was in adult intensive care, which at the time I was really disappointed with, but actually the skills that I learned really made me think about nursing differently, and also challenged me to think that actually there were lots of different roles out there. And it was one particular day that changed my career path, when we had a small child admitted to an adult ITU because there were no local beds for children. And the child had been in an accident, so the injuries were avoidable, and made me think about what did I want to do in going forward. I was really tired of putting people back together again, and wanted to think more about how we looked at some of the preventative work. So I went off to do my registered sick children's nursing at the time, and then worked on a number of children's wards, but focused predominantly on the early years, and particularly with very sick children, and loved every minute of it, and enjoyed working with children, but knew that I needed something else to drive me. And I left the West Midlands where I was working, and went to work at Great Ormond Street to undertake my paediatric intensive care unit. So there was still a bit of a pull back to working in critical care. And I worked at Great Ormond Street. It was an adventure to me because I'd never actually been to the capital. I'd never been to London. I'd never met anybody from London. So it was a great opportunity, both for learning, for developing, but also socialising and actually being part of a new city. And I enjoyed every minute of it, and went on to become a speciality manager working in Westminster Children that subsequently closed, not because of me, my NIAD. It became a bigger and better hospital as part of the Westminster and Chelsea Hospital. And I really enjoyed working with families, working with children, spent a lot of time actually developing new services. I set up a bereavement services for families that had lost children. And it was really rewarding. But again, I felt that there was more that I could do. I enjoyed working with students. I enjoyed developing others. I enjoyed mentoring other people. And I was quite homesick. So I did move further to the north, and actually secured a post working in education, which again was quite a twist for me, going from, acute clinical to then suddenly, as an unqualified tutor, starting to lead Project 2000. and to set up the first ever child branch in Wales, and develop a new and deliver a new programme. And nurse education was quite a remarkable opportunity for me. And I spent probably about 8 years in nurse education, working first in Wales and then in England, setting up and developing programmes, working on undergraduate programmes, postgraduate programmes, and actually delivering some multi-agency integrated training programmes as well. And really enjoying watching students develop, linking with clinical areas, but also the thrill of actually having people coming through that door on day one, knowing that they were on their first stage of their journey to become a nurse was remarkable, and then watching them and developing them over the 3-year period. And actually some of them have kept in touch with me, which is really good to hear their journey. I really loved nurse education. But one day an opportunity came up working in a different role, and it was setting up one of the first ever Sure Starts in England. And I thought, I need to do this. I need to give it a try, and I need to have a little bit of a change of direction. So I did. I went to work in a local authority. This was a real culture shock for me because I'd never worked in local government. I'd never worked for a council. And the council had never had a nurse working for them. And there was some interesting conversations, shall we have, about what we all thought, and now the collision of our cultures was quite a learning experience for both me and for the organisation. But it's fair to say we went on to develop a really, really positive programme, a well-established, one of the biggest programmes in the country, and we achieved some really, really fabulous outcomes for children that were amazing, and engaged families in that development. And it gave me the confidence to think outside of my comfort zone. And the role that followed was when I went to work in a council where I led a team of a policy team where we worked on new policy coming out of the government on leaving care, children and youth justice, young carers, and children that were in the care system, and children that were actually in residential care homes, and looking at developing new standards for children's homes, which was remarkable for a nurse to be leading this rather than a social worker. And it meant that we were able to test out different ways of working and new models of working. So that was really, really enjoyable. And I stayed there for a number of years, working with the Welsh Assembly Government and the Children's Commissioner for Wales on whistleblowing and abuse of children. And it was fantastic to be doing that work. And we did achieve quite a lot. But I really did miss health and some of the work that we did around nursing. So I secured a job back in England working in regional government when we had them back in 2008. And I took a role as regional teenage pregnancy coordinator for the Northwest, 24 local authorities at the time, and the highest teenage pregnancy rates in Europe, which I think if that wasn't a challenge, I don't really know what was. But it was amazing to work with 24 local areas, with nurses, with contraceptive services, with abortion services, with local authorities, with many different aspects of health to try and support girls from not becoming pregnant, but also supporting them when they had become pregnant and on their journey. And it was an amazing opportunity to get involved with regional government and working with national policy, because teenage pregnancy was a national priority. It was quite challenging working with ministers. I'd never worked with government ministers before. I'd never worked with government policy before at that level. So it was quite an eye-opener to see how government worked and how we could actually influence as well as deliver policy. And I really enjoyed every minute of that. And that opened the door for me into working with Viv Bennett, who was Deputy Chief Nurse at the time, the Department for Health. And I secured a job working with Viv in the policy team there for nursing, which I enjoyed. And I led the work on school nursing, district nursing, community children's nursing, and general practice nursing. And it was absolutely wonderful to be working with an inspirational leader like Viv Bennett, and having exposure to many other policy areas to be able to see how nursing could be embedded within that. But then also thinking about, you know, how we were the voice of nurses, how we could make sure that nurses were listened to, and that ministers and policymakers understood what their policy meant for people working on the ground. And that was, for me, was a real game changer. And it inspired me to think about my leadership scholarship with the Florence Nightingale Foundation. And I'd looked for many scholarships, and none of them really did it for me. They were kind of a little bit the same information repackaged, and none of them actually switched a light on and made me think, I want to invest my time in this. And it was Anne Cooper, actually, another scholar, who actually was undertaking her scholarship at the time, and said, I'm doing this scholarship. And I said, I want to meet with you and tell me about it. And then I was hooked, and I applied, and I was fortunate. My next role was when we moved across to Public Health England, when the new nursing directorate was being established about 5-6 years ago now. And I had the opportunity to move with Viv as the chief nurse within Public Health England, and to establish a new nursing directorate, working with another scholar, Jo Boson-Kett. And we were a very small team at that time, and we have subsequently grown and taken on new areas of work and new team members, and the most recent addition clearly has been the COVID work. But during the last 4 years, we've also become a collaborating centre, which I'm delighted to be deputy head of, and we've developed our international work, and a whole array of different work within the team. So that's kind of my journey. And I never thought that I would be where I am. I never thought that I would be a leader. I never thought, and I think sometimes you have to take a step back and think, am I really a leader? Or am I just doing a job that I really, really enjoy? And I think it's a mixture of both. So I think I've been lucky, but I think I've also taken every opportunity that I could. And I've also looked for opportunity, and nursing has opened the door for all those opportunities for me. So it gives you a kind of a little bit of a flavour of my journey.
Fabulous. Wow, that's amazing. Thank you so much, Wendy. Gosh, there's just so much there, and I'm sure people in the audience have got questions or elements of that they'd be interested in hearing more about. So let me open it up. Does anybody want to ask Wendy any questions? Give me a wave. So I have a question for you, Wendy. Perhaps our audience members will get brave in a moment and chip in. But when I asked you before about your journey and that question around why does leadership matter, when I was listening to your story, what I was particularly struck by was at every level throughout your journey you have demonstrated leadership, and you spoke about influence, and you spoke about being part of innovative service change delivery and the impact that had. And I just wonder if I could get your views, your opinion on that sense of nurses as leaders at whatever point in the organisational hierarchy they are, or whatever point in their journey they are.
Yeah, I mean, I think that's really important. And I think at all points in our career, we're leaders, and at all levels, we're leaders. And I think it's important for us to take that role on and to actually be a good leader for either our individual patients or clients, or for the area that we're working in. And as nurses, we're able to do that with passion. And I think we're able to do it with veracity as well, because we actually understand the impact that this will have. So I think we're more self-aware of what that will mean. And sometimes I think it's really difficult if we're leading something that we might have reservations about, or we know is going to be contentious. We still lead these projects and pieces of work with the veracity that we think that they need, because we know that there is an opportunity here for us to actually capitalise on. And I think it's making sure that we are authentic leaders as well, and that people can understand why we're actually taking the stance, and we're open and transparent. And I certainly like to think that I'm an approachable leader, and I'm very open on social media, so people know that they can contact me and that they can get in touch, and I'm always open to ideas. And if it's okay, I'll give you an example. There was a young man, and he'll know who he is, that a young male nurse that got in touch with me on social media and said, all of this work around children and young people is great, but what are you doing about military families? And I said, okay, that's a good point. Well, tell me, what do you think we need to do, and what do you think the gaps are? And I think he was quite surprised that I responded to him. And he responded, and he sent me his email, and we corresponded. And then I invited him to come to a meeting in London and give his views on being in a military family, but also his views from being a nurse that supported military families. And he came, he presented, he was fabulous. And that led to a whole cascade of work that took off with the Ministry of Defence, with him then getting involved in developing pathways. And then eventually he started his PhD, which focuses on military families. And it did lead to some changes within the Department of Health, and for us to do some really bespoke work with health visitors and school nurses to raise awareness about the needs and well-being of military families. And that work has now been really embedded and as part of the covenant. So that small conversation led to a whole catalyst of activity, which he was instrumental in doing. And I just supported him and opened the door on his journey, which was amazing to watch.
Oh, fantastic. Wow. And that just shows, doesn't it, through networks and the platforms that we can open up for people, that they can demonstrate their expertise, and that's such a valuable and unique perspective is heard then by policymakers and government and those individuals that wouldn't necessarily have had opportunity to hear those stories. And that leads to my next question, which was around the political influence that you've had. So you talked first of all about your experience of setting up the first Sure Start Centre, and I remember that really well as a mental health nurse, working in a very deprived area in Nottingham city centre, and how significant and how much impact the Sure Start Centres had. But you also talked about how you went on to have actual positions within government, and I wonder if, again, if I could ask your reflections and thoughts around nurses and their political influence, and what relevance does the political world have to us as nurses?
I mean, that's a great question. I think people often think about politics as with the big P and how we influence ministers and the Prime Minister, and actually there's politics within all levels of our work, and there are similar principles I think that we need to think about, which are about the way that we approach politics, and how that we actually consider all of the elements to the argument and the proposals that are being put forward. And I think certainly working very closely with ministers, it's taught me quite a lot about, they are also under immense pressure. They have a manifesto, they've got commitments that they want to deliver, and, that we can support them and guide them and give them really good pointers and evidence about what would work in nursing, and what as nurses we bring to the table, and how actually having nurse-led programs can really make a big difference. So I think it's about telling the story that ministers will understand and will resonate, but also being able to give them really concrete examples about where for nursing we've made a difference. And that's why we constantly ask for case studies, or we want to bring ministers out to actually shadow nurses or to see what we do in practice, because I think we're quite blasé as nurses about what we do and the impact that we have. I mean, I don't think we understand the true impact of what we do. If we were to ask all of you, what you do as a nurse, we would feel it necessary to fill a whole flip chart about all the detail. But actually, if we asked a group of doctors, they can usually pin it down to 3 or 4 really hard statements. And I think as nurses, we still feel that we have to prove our worth quite often. So we have to give too much detail. And I think what it's taught me working at a government level and with ministers and politicians is we don't have to try that hard sometimes. We do make an impact, and it's actually about showing the impact rather than all of that peripheral information. So I think for me, what I've learned is to show impact, be able to show that we make an impact, be able to show that we can give a considered argument and show both sides to any kind of argument or any kind of proposal that we're putting forward, and to think through really what is the bigger agenda that we're trying to achieve here? And sometimes there has to be some give and take on the way. So things that we might not want to happen, we might have to have give and take on so that we can actually achieve the bigger picture. So it's always having sight of that, being flexible, but being transparent. I think that's where when we do make mistakes, is that we're not transparent or we're not authentic. And for me, I think that is really, really important. And understanding the culture. So there will be different cultures within different parts of the government, the ways that they work are quite different. How we work with the Department for Education is different to how we work with DWP, etc. So it's understanding their agendas, their culture, what what they need to achieve in that year, and then being able to tailor some of those messages. But I think it is quite exciting working with politicians. It's exciting and challenging, and it's rewarding as well.
Absolutely. So learning the language. I know Greta's turned her microphone on, so I think there might be a question for you in there. Over to you.
I do not want to spoil anyone's thunder, so please, if you've got questions over and above me, then chip in now, because I could talk to Wendy all day. Does anybody else have a question right now? No. Oh yeah, go on then. Yeah, you see, look, always happy to stand back despite the bravado. Go on.
Well, I don't want you to stand back, but it keeps springing into my mind, Wendy, given your journey. I'm a great believer in not always changing things. And I started my nursing career when I was almost a child at 17. And one of the things that's been a consistent thing for me is involvement of family and carers, because you can imagine if you started nursing in 1974 when I did, they were pretty much excluded, both for adults and for children and everything else that goes around, you know, no matter what was wrong with them. And I just wonder, working now at the level you're working at, what's the word I'm looking for? How authentic is one of your words? Authentic, committed are you and your programme of work and the ministers you come across in seeing families and carers, unpaid carers, who save the government, any government, millions, being involved in what I would call sharing care or partnership of care in an authentic and positive way. And why that springs into my mind was that carers, unpaid carers, were originally not on the list for getting the COVID vaccine, which I thought was appalling.
There's some good points there, Julie. And I think for me, one thing really I should have said is that I have always been committed to actually ensuring that whatever I do, that children, young people, families, whatever programme I'm working on, that I involve actual direct the people it's going to impact on. So as well as nurses, importantly, and midwives, making sure that children, young people and families also have a voice. And when I led a piece of work on carers in the department, and we were very clear that carers needed to be involved in this. So we worked very carefully with carers through carers organisations, some of the third sector organisations that we're still working with now, and actually gave them a voice. And it did lead to some changes, particularly for the change in terms of the care bill, but also particularly for young carers who at that time were not entitled to an assessment, whereas now they can actually have an assessment. So I think it did lead to some changes. And the only reason it led to the changes was not because of me. It was because of the voice of young carers actually and giving them that platform to actually have that discussion. And I think there has been more of a focus on carers, adult and children carers, over the last 7 years, 5 to 7 years, and clearly we still have a long way to go. But there is a real commitment and recognition of the contribution that carers make and the impact that it has on their lives. And I think 10 years ago, I would have said that it wasn't as prominent, and there were pockets of work that were happening, but it wasn't joined up. And I think we've seen through a lot of the preliminary work that we did in DH, now coming to fruition. Now we've got NHS England leading programmes of work that are directly related to adult carers and to young carers, which we didn't have before. And we've got funding that's going in. So I think whilst we're not there entirely, I think that we've made huge strides for recognising the needs of carers. And I think thinking through COVID, it's actually also shone a light on carers and the contribution that they've made and they continue to make, but also it's made us think about the impact on their health and well-being. So for many carers during COVID, they've not had that respite that they probably would have had before by going to work, or for young carers by going to school. So I think that we probably need to do some further work in looking at the impact of COVID on carers and what we need to think about, what would support them in going forward, and if we had a similar situation again. But I think you've raised some really interesting points, Julie, and I think the way to influence is to get involved, and the way to get involved is to knock on those doors of people like Jen Kenwood, who's leading some of that work, and you know, to kind of share your views. And I think the carers agenda is going to be ongoing, and it's going to continue to need more and more support. So I would say, let me link you with Jen Kenwood and have some further conversations with her as well. But carers, absolutely phenomenal, and they've done an amazing job during COVID.
Thanks, Wendy. Brilliant question, Julie. Thank you. Maggie, I saw you give us a wave.
Yeah. So I've got a question about the last year, really, in as far as 100 years ago, at the last big, massive international pandemic, people then would write beautiful letters to each other explaining what was going on in a very sort of matter-of-fact kind of way. And a real, both oral and written history, non-academic, was collected of people's experiences in leadership and the experiences that they had either hospital or at home caring for people that had Spanish flu. Is there any, and I'm quite interested in this because I think I don't think Facebook and Twitter quite capture some of the experiences people are having. And I'm quite interested within my military critical care cohort of collecting some stories together so that actually other people can read it and understand that they had similar experience, felt the same, and felt under the same pressure. But is there any particular event or thing that has stuck with you over the last sort of 10 months linked to the nursing response or nursing leadership response to COVID that has stuck with you that you think is worth remembering?
Some really good points in there, Maggie. I could talk about them all afternoon because they're great. I mean, I think for me, I think we do need to capture some of these stories. And I agree with you that we've heard a lot on Facebook and Twitter and various platforms about people's experience. I think it probably hasn't captured all of it. We've also done some quite bespoke work with young people to capture their experiences of COVID, which is phenomenal, because we've heard a lot in the media about young people really flouting the rules and not kind of adhering. And actually, it isn't true. We've seen some remarkable contributions from young people during COVID, and they've obeyed the guidance. So I think it would be great to capture some more, and maybe that's something we could do with the foundation. Really, I think I'd love to capture some more of those stories. We have captured some of the stories, the case studies from practitioners. So we've got a hub, a library hub, where we've captured some of the ways that nurses have responded in a professional capacity. It doesn't capture some of the hearts and minds things that you talked about, but it shows the way that they've been remarkable in responding and reacting and changing the way that they've delivered services, but still been able to show some impact. And they're quite remarkable. And we've got a library hub that's collected some of those, so we could share the link to that. And within PHE, we employ over about 300 nurses directly, all in different roles. And the way that they've responded to the pandemic has also been remarkable. And one of the things that has stuck in my mind is the way that probably a lot of the public health nurses haven't been recognised in terms of the contribution they've made. And not just public health nurses, I'm sure there are other pockets of nursing as well. I don't think they've been recognised in the same way as those that are working maybe in acute hospitals, in A&E, in ITU. And we've heard a lot about the front line, and people think the front line is being at the bedside. And for me, what stuck in my mind is when I've talked to a number of nurses working in the community, is that they've almost been invisible by the media, by the press, and actually they've kept many families well, they've kept many families safe. And I think that needs to be captured as well, and people need to be aware of that. And for me, I think it's an area that I would like to focus on as part of our collaborating centre. We've been asked to look at some of the lessons learned, and I think we'd like to look at it also from a community perspective, as well as capturing some of the insight from those working in hospitals, because everybody is being impacted by the pandemic, and everybody's work has, and I don't think people have actually seen that. And I've heard some remarkable stories of district nurses, health visitors, school nurses, mental health nurses working in practice with very, very vulnerable families that wouldn't necessarily have, and individuals that wouldn't have seen anybody, that have been really impacted by this. So I think for me, the biggest thing is understanding that there's more than one front line.
Yeah, I think it absolutely is that. And the haters are going to hate out there on social media. They've been told, but you're just doing your normal job, and I'm like, there's nothing normal about what's going on at the moment.
No. And I think we're quite fortunate in England that our nurses and midwives in the UK really have been seen as everyone's recognised that they're key workers, that they've been doing an amazing job. And I think the general public have really got behind them. If we look at some of the messages from Europe and from international perspectives, nurses and healthcare professionals haven't had that same sense of doing a good job. And we've heard from some countries where they've had very high suicide rates in nurses, where nurses have actually been banned from their local communities because local communities don't want nurses to bring COVID into their community. And I was talking to a colleague in another country, I won't name, and he was telling me about an experience that a nurse had had. She'd been working in the hospital. She'd stayed overnight for 3 nights so that she could be there. When she came home, her front door had been boarded up by somebody in the local community, and they wanted her to leave. I think, gosh, we have no idea of what that's like, because nurses, doctors, key workers have been recognised in England, but it's not the same everywhere. So I think people have recognised, and that's partly because I think our chief nurse our chief nurses across England, across the UK, have been really vocal during this time and flown the flag for nurses, and organisations such as Florence Nightingale Foundation too.
Thank you. Thanks, Maggie. Greta.
Well, kind of, Maggie, that was, you covered off one of the questions I was going to ask. But Wendy, I think just looking at the audience that are here today, perhaps come from an acute adult background. And so my question is really, I'm intrigued to understand what how the COVID response was mobilised to protect the vulnerable families in our communities, and whether you've got some shining stars out there that are beacons of good practice and what they've done at this point for those families.
Thank you. Yes, I think there's a lot of examples from the community. I think we've seen district nurse teams changing the way that they operate and been absolutely remarkable. And I think, you know, working in really, really difficult situations and really quite isolated. And I think talking to a group of district nurses recently, you know, the fact that they're not able to go into the office even to have a handover because they're social distancing, for them being out on the road, not having anywhere, not having a base to go. I mean, it's been phenomenal. You know, my partner's he's a district nurse in a team, and, you know, they're having to think that you've got, you know, you haven't even got a hot drink with you necessarily. So you've got to be really, really prepared. And they're fundamentals that we don't think of. And for many of the staff that are working in the teams that are the lower grades, you know, for them, the amount of travel that they've been doing, because there's huge distances between, and not being able to kind of, you know, we're thinking about things like not only food poverty for some of the nurses, but also things like fuel poverty, the fact that they're driving long distances without seeing anybody, not getting the support that they would. I think, you know, you're not even being able to talk to somebody unless you ring them. And it's very different being in the hospital. I think you've got some support where you can, if things are going really badly, you've got somebody that you can talk to, but you've got to physically make an effort if you're working in the community to pick up that phone and hope somebody's going to be there to actually have that conversation with. And it, you know, we hear a lot of services behind the screen, don't we, at the moment? They're virtual, but actually support behind the screen for our well-being is really, really tricky to manage, and you can't pick up how people are feeling. And we've had many community nurses that have been moved to be redeployed to work within hospitals that's out of their comfort zone. They might not have worked there for 20 years. And it's been, you know, people think a nurse is a nurse is a nurse. And we all know on this call that we're not, we're all different. I couldn't step into your world and it would be really daunting for me. And likewise, for some of our nurses that have had to make that adjustment, you know, being told on a Friday you're being redeployed on Monday has been really impactful on their mental health and well-being, but also the way that they've worked. If they're used to working Monday to Friday, 9 till 5, they've done that for a reason. And, you know, then having to change the way that their family is managed. So I think for me, I think there's a few things really. I think it's the way that perhaps our staff have responded within the community, that they've been really, really responsive, both in district nursing, health visiting and school nursing. I think when the pandemic first started, I think people thought that services for children were nice to do, but they weren't necessary because the pandemic at that time wasn't really affecting children and children were relatively invisible. But as the pandemic has gone on, we've realised that actually health visitor school nursing services are really, really important because the pandemic is affecting families in different ways around safeguarding issues, around vulnerability. Families are living in pressure cooker families. We've got families that are living in very confined spaces that wouldn't normally do that. They've not got that outlet for going to school, going to nursery, going to work. So even the most secure relationship can be challenging during this time. We've all, I'm sure, had challenges over the last 9 months. And for families where we've got a new baby or we've got a child with additional health needs or we've got somebody with an adult that they're caring for with mental health issues, that has been really, really taxing on those families. And we've seen more families that have become vulnerable. We've also seen less access to services. So we've had late diagnosis for some children for some conditions because practitioners just haven't been able to see those children face to face. So I think some of those issues have been really, really fraught for services. And so redeploying them very early on, health visitor school nurses, meant that families had even less access to support. Clearly, we worked with our chief nurse, Viv, and Ruth to get letters out to all services to make sure that we were able to maintain health visitor school nurses in the community so that these families could be supported. And I'm pleased to say that we've managed to address the redeployment issue very, very quickly. And we've got services being very innovative, looking at different ways of delivering services and being very reactive to families. And that, I think, has been really, really important. And it's been really important for our children, school-age children as well, because we know that there's been a huge spike in mental health issues. And we also know that there's been so many days lost in education that it's going to take a long time to actually pick that up. And as well as schools being an opportunity to educate children, they're also a way of protecting children. So school is a protective factor as well. And for some children, it was going to school was the only way that they got not only respite, but for some children, a hot meal. And, you know, we've been able to maintain free school meals, but for some families, it's been really difficult thinking about, you know, the changes with their financial situation. Partners may have lost their job. Families have been forced to stay at home and homeschool their children. So all of these pressures have meant that children have become vulnerable, families have become quite vulnerable. And we've really needed health visitors, school nurses, practice nurses to actually keep that contact and to think of any opportunity that they can to have contact with families. And a good example would be our practice nurses that have been delivering the childhood immunisation programme throughout the pandemic. So we did some work to make sure that they were fully up to speed with safeguarding, so that, you know, they're one of the only professionals that will undress a baby at this time because they need to give an immunisation. So it gives them opportunity to actually talk to mum and dad and partner and actually, you know, have an idea in their mind about safeguarding. So we've used every opportunity that we could to make sure that professionals can think about children being safe and supporting families, but also thinking about their own well-being as well. And we know it's been a tricky time for everybody as well. And I think, for me, it's making sure that, you know, we are all one big family, whether we're working in a hospital, we're working in the community, we're all one big workforce. And our ambition is to make sure that those that we serve are protected, they're well, and that we feel that we're able to do a good job. And I think we've done an amazing job during the pandemic.
Crikey, that was a very fulsome answer. Thank you, Wendy. As you heard me say earlier on, I could listen to Wendy all day. I could monopolise the question session, but I won't, because I'm sure others will have questions for you.
Thank you, Greta. Thank you, Wendy. Oh, so we've got, it says J Styles. I'm not sure. Do you want to? You go ahead.
I'm not sure why it says J Styles. It's Janice. Hi. I suppose if I think about the last year, I think what's impressed, I mean, you know, lots and lots of things have impressed me. But if I think about my team, I look at them and I can see how creative they've been, adjusting to things so quickly and given that freedom, because we had to give them freedom, didn't we? We were kind of like, we have to deliver this. How are we going to do it? Kind of get on with it. And at the beginning of the pandemic last year, I got COVID, and they were literally at times coming to the end of my drive and saying, can we do this? It's just like, go out and do it. And I was thinking, I've thought so much over the last few months about why was that not there before this pandemic? And actually, we've got to make sure we don't close that down when this is all over. You know, I'm a midwife, and so it's community midwives, particularly I'm thinking about. The whole pathway changed. We suddenly couldn't go and visit women at home. We got kicked out of the GP surgeries pretty quick. Mm-hmm. And those women went out and they still covered that service, and they still do today. And it's just about, for me, how am I going to maintain that? So kind of any hints, tips on that, Wendy, really?
Yeah, I mean, that's a great point. And I think midwifery services have been really fabulous the way that they've responded. It's been, you know, at a time when women are feeling really vulnerable and nervous about, you know, having a baby during a pandemic. Wow, that's so scary, isn't it? So yeah. They've done absolutely fabulous different ways of thinking. And I think I would share your views that, yes, this has allowed us to actually take a step back and think and encourage that creativity, and people have really used that. I think, and we've had similar things, Janice, in our team as well. You know, we've had people that have been moved to deal completely with COVID during this pandemic, and they've just risen to the challenge, and we've seen new skills emerging in them that they didn't know they had. You know, they've said, I didn't know I had that. And through some support, we've enabled them to actually develop those and to have the confidence. I think for me, it's about actually capturing some of those examples and actually showcasing them, because we're not, as nurses and midwives, we are so bad at saying that we've done something well. We just don't do it. It's just part of our job. Oh, well, it needed to be done, so I just did it. Yeah. And I'm not sure that any other profession does that in the, you know, that we would hear more about it. So my plea would be that we actually capture some of this and we celebrate it. And I think there will be opportunity, hopefully during this year, to celebrate. We've got a rollover of the Year of the Nurse and Midwife. Let's actually, when we move into more normal times, let's use that opportunity to showcase all of those examples, not only in your local area, but nationally and also internationally. And I'd love to hear some of those examples so I can flag them and showcase them and give people that credit, you know, make sure that they actually receive some recognition for what they've been doing. And the recognition, sometimes I think a thank you letter, a handwritten thank you letter, goes a million miles more than anything else. We send emails and people just read them, but I think just sometimes a card with a stamp on, very old-fashioned, I think speaks volumes to people, and unexpected, just through the post, it means an awful lot.
Thank you.
Thank you, Wendy. Thank you, Janice. And one of the things I was interested in, Wendy, is around, in your position, which obviously has significant national profile and high-level accountability responsibility, how do you still maintain a sense of connection to the lives of the young people and the families? I'm interested particularly, I know you said on Twitter, and I was really interested to ask you about how you're an independent visitor for looked after children, and I wondered if you might share a bit about that and other ways that you maintain that connection, I guess.
Well, my passion is about being with children and young people, and it's always been something that I've actively been kept in touch with children and young people throughout, and I've always built into any work that I do opportunity to engage with them. And a funny story was, we invited a group of young carers to the department to actually receive an award. And when they arrived, the security men there were panicking that the young people would play the piano. I don't know why we had a piano in the entrance, but they were panicking about them playing the piano. And I'm thinking, I'm not sure they're going to be interested in that at all. But I think there's something there about, you know, people not really understanding young people. So I've always tried to maintain this, and I am an independent visitor for children in care. I love every minute of it. I do get some free time to be able to do that. So usually at the weekend, and I support 2 young people who are within the care system. And I've been supporting one for nearly 4 years now. And through all of his trials and tribulations, he continue, and it's his choice of whether he wants to continue with it. And it's a fabulous role that I volunteer to do. I get to go out once a month with a young person. They choose what we do, what activity, and I'm able then to talk to them as well about issues they want to discuss about being in the care system. So we've been working currently with one young person on his mental health and well-being, and looking at strategies of how we can overcome some of his anger management and issues he has, which are hardly surprising because he's had quite a number of traumatic experiences. So I'm able to use my nursing skills and my listening skills, my compassion, but keep grounded and to try new things. So I'm never stale. And because he gets to choose the activity, I have no idea what he may choose. And it can be anything from trampolining, which was quite good fun, to going to the zoo, to anything in between, and sometimes just for a long walk, or surprisingly enough, for a young teenager, he picked strawberry picking. He wanted me to take him strawberry picking because he'd never done anything like that. So we get to do lots of different things, and I'm quite grounded then because I can hear from him what's happening in his life, what his issues are, and he's able to talk to me. And the organisation that I volunteer for, we do peer support. So I get to hear from other volunteers what their issues are. And they have no idea what I do, and I have no idea what they do. So it's a level playing field. And we're able to share our experiences to support each other. And it's a fabulous experience. So if you do get the opportunity, I would strongly recommend doing that. I can't underestimate. And lockdown has meant that clearly I've not been able to visit the young people that I can. So we've used different ways of keeping in touch. We've used letters, postcards, Skype, etc. And it's been quite interesting because clearly he's very advanced and gets frustrated when I can't keep up with the things that he wants to do on Skype and Zoom, etc. And we've been able to send a little gift every month to be able to let him know that he is important and that he is thought about, because it's been quite challenging for him, and clearly with schools not being open, not being able to maintain his friendships and his peer support as well. But it's amazing. But I think all the way through my work, I've engaged with children and young people and families, and I make it a key component, and it keeps you grounded, and it also shows that you're listening. And I've been able to do some fascinating things, go and visit young people when they've been having camps away, where I went to a young carers festival, and I turned up, and I wasn't quite sure what to expect because I quite often get pointed in the right direction and you're going to attend this. So I turned up to a young carers festival, and I'd gone out, I was driving along and thought, this looks very bizarre. And it was like Glastonbury. There must have been 300 tents in the middle of this great big kind of field. And I thought, what have I come to? And it basically was like Glastonbury for young carers, with lots of kind of different activities that were happening. There was face painting, there was a live band that they were all performing. They were all young carers. There was all kinds of things that were going on. And it was basically a long weekend where nearly 2,000 young carers aged between 14 to 18 got together. They were supervised. It was all run through one of the charities, and they had time for themselves. There were wellbeing pods where they could go and actually have some mindfulness. There was all kinds of activities that were happening, baking, cake baking, decorating, you name it. And it was time for them. And they also did some activities as well about getting their voice. And they'd invited me along because I'd done some work around young carers and developed a young carers pathway, and I spent 2 days with young carers, kind of finding out what their issues are, having fun, being terrified by having to do high wire things, and the most terrifying thing was being interviewed by 3 young carers on their live radio station. So I think, yeah, but it was amazing at the same time. So I think you can always build in things like that into your work. And it is important that even when we're busy, and you could have back-to-back meetings with policy leads, different officials, I think you've got to make the time to think about why you're doing it, and to actually connect with the people who it's going to make that difference for.
Absolutely. And are there any standout messages from those interactions that you've had that stay with you when you go into those meetings, the big meetings where you have the opportunity to have the influence that you do? Do you have a mantra in your mind that's been passed on to you by any of those young people?
Definitely, and it speaks volumes. It speaks more than any message. I could go in with a 4-page document with all the evidence and research, but actually, if I can give a small vignette of what a young person has told me, what their journey has been, then it's made a massive difference. And from some of the work we did with young carers, 2 of them actually came and did work placements with us. And they actually got to go to the Houses of Parliament. They got to see different things, and they got to meet some really influential people and tell their story. And one of them wrote a blog for me as well that went on so they did amazing things. And that was just because I was in the right place I was in the wrong place when they did the high wire things, but I've learned my lesson from that. But I think I think their voice matters, and being able to use their voice and to show them that their voice has made a difference, and to be open as well. I think with young people, many people shy away from involving them because they say they're going to ask for things that we can't deliver. And actually, I've never come across a young person that's asked me for something that we can't deliver. They're usually practical solutions. And if we can't do it, if we explain why, then usually they're very pragmatic. Where they get frustrated is when we don't give them any feedback. And I think that's the same with adults. When we have forums with adults and we ask what their views are, and they give them to us and we don't do anything with it, or we get a block and we think, oh, it's too hard. If we just went back and explained, we would have much more credibility.
Absolutely, absolutely. Thank you so much, Wendy. Robbie, we haven't heard from you yet. I just wanted to check in, see if you had a question or comment for Wendy.
Yes, thank you. I have got one question. It's more generic about nursing leadership. But there are many qualities that a nurse leader is expected to show, like emotional intelligence, critical thinking, mentorship, and so on. What do you feel, in your view, is done well on the whole, and what do you think requires more work? And do you think this has changed due to the COVID pandemic and having to get better at different leadership attributes and bring them more to the forefront rather than the standard leadership attributes that nurses are expected to show?
Yeah, it's a great question, Robbie. I think for me, the key attributes, I think, are, as you've said, it is about being authentic. It's about being transparent and approachable. And I think it's actually, for me, very much about being politically aware and emotionally intelligent. And I think the bit we don't do particularly well is being politically astute. We're not very good because we think politically astute means being involved in politics. And for me, I think, that little p, working locally, is just as important as the big P, working with government and with ministers, etc. And I think it's one of the areas that I don't think we do very well, and it's certainly not something that's covered within the nurse curriculum, or we encourage. And I think partly that is because traditionally nurses are not involved in politics, or that's how it's perceived. And I think what we have seen is a bit of a shift since we've had more visible leaders like Viv and like Ruth and the other CNOs in the other countries. And I think because they've been more visible leaders and people have seen them operating at that level and more in that political space, that people are more interested. So for me, what I'd like to see is probably more support on how can we develop that political awareness in a way that's actually constructive. I've seen some really poor experiences on Twitter where people have contacted and put messages directly that are really provocative to either nurse leaders or to ministers or to other policy leads that have been quite provocative, quite probably unprofessional, really, and I think that has also left them quite vulnerable themselves as practitioners. And I think that's partly because they've seen other people behaving poorly and they've modelled that behaviour. So I think for me, particularly as we're in such this open space now around social media and people can say things and think they can, I'd like to actually think about how we protect nurses through increasing their political awareness. So I think that's something I'd like to consider and to try and take forward. I think that's got to be crucial, because some of the messages that I've seen have been not particularly good, and it could land them in hot water. And not to stifle people's openness, because I think you can do it in a way that actually is more engaging and you actually get something from it. I mentioned the young man earlier that got in touch with me. He could have been quite provocative and difficult, but he actually did it in a way that was encouraging and made me want to reach out to him. So I think, and I think I've forgotten the second part of your question, so apologies.
The second part was roughly about, do you think the attributes that we are good at and we need to improve on, do you think they have changed priority during the COVID pandemic? And do you think certain attributes are required more now than they have been in previous, prior to the pandemic?
Definitely, I think there has been a change. It's a great question. I think there has been a change. And I think partly because people are looking to us as nurses, as healthcare professionals. The public are looking to us for the answers. They're looking to us for that role modelling. They're looking to us to actually provide quite a lot of support, really. So I think it has changed. I think for me, what I've certainly seen is that people are operating in a more open and transparent way, and there is also some that professionalism there still, but I think we have been more transparent as a profession, and we've seen more leadership from our leaders. I think we've been more visible as leaders and more contactable and taking forward the issues, and people have seen nurse leaders at a national level taking forward those issues. So I think they felt more able to contact and connect with us. And I think nurse leaders working on the ground, I think for me, what I've seen is that people working together and actually protecting each other and showing that through their leadership skills, protecting their service and making sure that people are aware what can be done and what can't, and very quick to respond when are being criticised for things that haven't been done or should have been done. So being able to step into that space to set the record straight. And I think previously, before that, we might have been a little bit, oh, is it really worth the effort because it's somebody making a complaint? But I think nurses and midwives have recognised that actually we do need to set the record straight, because others might be reading this, others, mums from maternity, other people who've got families in intensive care, and we need to set the record straight that this is actually what happens. So I think for me, leadership has changed. I think it's become stronger as well. I think nurses have actually always been amazing leaders, but I think we've seen them protecting their workforce, their teams, and being ambassadors for the profession, whereas we've seen pockets of that previously. It's felt like quite united, and we've seen people that work in different areas protecting each other, people that work in acute settings being the voice for people in community settings, and vice versa.
Thank you. Thank you.
Sorry, just to add to that, Do you think seeing people like the chief nursing officers on TV being stood next to politicians and that sort of thing, do you think that has helped highlight the cause of nurses, the job role of nurses? And do you think that that will continue after the pandemic, or do you think we may go back into that state of people know what we do, but we don't get that representation in front of the public as much?
I think we're very fortunate that we've got some really strong leaders and visible leaders. And I think that they will maintain this beyond the pandemic. And I think that they've always probably been visible, but people haven't been necessarily looking in the right places. So I think that, we will maintain this. I think post-pandemic, we will have a lot of work to do. And we're also still in the year of the nurse and midwife. So we need to use this opportunity, not only nationally, but internationally, to actually raise the profile. There's a lot of work we need to do on the nursing workforce as a whole global approach to this. And I think we need to maintain that. And actually, for me, we need to get more of our nurses. The time isn't right at the moment because everybody's up to their neck in the pandemic. But when we're in more normal times, we really need to get more of our nurses involved in some of the international work and supporting some of that, because it's an opportunity both to learn but also to influence as well.
Thank you.
Thank you, Robbie.
Thanks, Robbie. Thank you, Wendy. As I was listening to you there, Wendy, it made me think that one of our CNO's objectives around one professional voice really does feel like it's come into fruition, doesn't it? And that's something that as a profession we've really struggled to achieve. It's always been very fragmented and divisions have existed, but this does feel like a time where we could claim one professional voice, which feels like an opportunity for us, doesn't it?
I think so. And I mean, Team CNO has been phenomenal, hasn't it? In the way, and all of the organisations coming together to be part of that. So, NHS England, Health Education England, Public Health England, it's been phenomenal. And it's, we all want to work together to support. And I think we've seen that through the pandemic. There was a lot of work in the background happening before, but certainly the pandemic has really unified everybody.
Absolutely, propelled us forward. Greta, I wonder if I could ask you to give a summary for us of the discussion. Any final thoughts or reflections on what we've heard from Wendy?
Well, first of all, Wendy, absolutely fabulous. I'm sure we could spend all afternoon listening to you. I certainly could. And you've got so much to say and so much experience, not just in this country, but across the world. And we really thank you for your services to nursing. It's incredible, and particularly around your not only your professional work around children, young adults, but also your personal involvement in those children. I didn't know that about you, and I really take my hat off to you. I met her, in the giddy days that you could go to gyms. I think we were in tier 2 or 3 at the time. I can't remember what it was, but by chance I was waiting my turn to go into a sauna, and we won't say which type of gym it was, but one of those well-known gyms. And I went in there, and there was already a young man in the gym, and he started talking to me, and I thought, oh, you go in the sauna to have a little bit of me time, don't you? Anyway, this guy was phenomenal. He was so upset because he was waiting to do his GCSEs, and he was worried that he couldn't do them because of the pandemic, and he was waiting for the decision. And I thought, gosh, you are clearly much younger than you look. And then he told me his story. He said, I'm really so excited. I want to be a doctor, and I've worked really hard at my GCSEs, and these are my A levels. And I thought, well, that's absolutely quite aspirational and inspirational. And then he told me he was a looked after child. Oh. And he was with his foster father, and actually his backstory was that his mother was severely mentally and physically disabled, and I don't know whether it was because of COVID, but certainly he was being looked after because his mother couldn't cope. But his backstory was, one of the reasons he wanted to be a doctor was because he had the experience of looking after his mum, and he knew what that meant to her. And he said, I just want to share that to everybody that I meet. And then he said, perhaps you could do some volunteering in the NHS. He said, I'm already in the St John's ambulance force. So I thought, well, that's amazing. And I told him about the NHS cadet scheme. Then he said, what do you do? And I told him, and I was absolutely roasting hot by then, because I didn't want to stop listening. I thought, I've got to go, I'm going to suffocate in here. But there's also a lady in the village that I've known for a long time, and she's looked after children for most of her adult life after her own children left home. And I'm totally in awe. So that was a long way of saying, not only are you a fab nurse leader, but your backstory, your commitment to young people and children is phenomenal. So thank you. Now, is that actually a roundup? I'm not sure. But I know that everyone has been engrossed in listening to you, and there's much more to say. And the way you've turned around services through your leadership for those children, whether that's in the district, whether it's in the community, whether they are looked after children, whether they're in school, it has been incredible during this response. So we're very lucky in this country to have you as a leader looking after our children. So thank you.
Thank you.
It's been thoroughly enjoyable. And on behalf of the Florence Nightingale Foundation, I really want to thank you, and thank you for staying connected with us. And you'll be sorry that you ever said, how can I help, Grisha? Because if this is what you can do, we'll be calling on you quite frequently. So on behalf of everyone, thank you so much for your time today and in preparing for what you wanted to say. Thank you.
Thank you. I've loved meeting everybody, and the questions were amazing. So thank you, and look forward to meeting you again, hopefully. So thank you.
And you know where she is now, and you know that she answers Twitter. So, but beware. Thank you very much.
Thank you.
Thank you.
Take care. Bye.
Bye-bye.